In this video, we'll look into the treatment of asthma patients. We all know when a patient comes with severe breathlessness to emergency department, the first line of treatment for asthma patient is bronchodilators. The second important drug which is given is steroids. Now the question is, even though steroids are not bronchodilator, how does this work? Now in this video, we'll see step by step how the steroid is working. Okay, so on steroid administration, it can either be given in the form of inhalation or a systemic injection can be given. Now if it is inhaled or given orally, what happens is steroid enters the lungs. Now if it is inhaled directly, remember easily the steroids will enter the airway cells. All remember, the steroid is a lipid soluble drug, so it easily crosses the cell membrane and enters into the cytoplasm. In the cytoplasm, there is a receptor, glucocorticoid receptor. So the steroid binds with the receptors present in the cytoplasm. So now forms a complex, right? Steroid receptor complex. This enters into the nucleus. There is a modulation of gene transcription, meaning some of the genes are either turned on and some of the genes are turned off. So what exactly happens is there is reduced pro-inflammatory cytokines or reduced inflammatory mediators, meaning cytokines are not released and the inflammatory mediators are not released. So what will happen? The eosinophils, mast cells and T cell activity reduces in the airway epithelium. So because these are usually the cytokines and the inflammatory mediators are the one which will call all these inflammatory cells into the airway epithelium, and there is a hyper-responsiveness in the airway. Now what has happened is after giving steroid, there is a modification or a modulation which happens at the gene level. So all the cytokine production, inflammatory mediator production, everything will reduce. So that will lead to reduced eosinophils, reduced mast cells and T cell activity in the airway epithelium. That leads to reduced airway inflammation, that will indirectly reduce the mucus secretion and airway edema. So this itself will reduce half of the obstruction which is happening, right? Remember, in asthma patients, the obstruction happens because of mucus production, the airway edema and all, and which is further precipitated by your smooth muscle constriction, right? So now when the inflammation is reducing, there will be an improvement in the airway diameter, reduced bronchial hyper-responsiveness. Usually in asthma patients, a small inflammatory trigger can cause bronchoconstriction. For example, just a small dust allergy, anything. So just the dust entry itself can cause severe bronchoconstriction. So now because the inflammation is reducing in the airway, the bronchial hyper-responsiveness has reduced. This itself will lead to relief of asthma symptoms. So how do you remember now? When you give steroids, it goes and modifies the genetic or the genes in the airway epithelial cells. So inflammatory mediators are reduced, and that will lead to improvement in these patients. So that is why this is given for a long-term treatment. Okay, for more such videos, you please subscribe, and if you like to understand the mechanisms behind the drugs or the pathophysiology behind the diseases, I just try to make it very simple for you guys. Please share it to your friends. Thank you.